This topic's about wound irrigation. Wound irrigation is cleaning out the wound. It simply is flushing out any bacteria that's present in the wound base. Wound irrigation is important in the healing process since cleaning out the wound reduces the risk of infection, leading to a clean wound base that can promote healing. For wounds that occur outdoors, it's important to consider wound irrigation to prevent contamination from the dirt, which can increase the risk of infection. Additionally, if the client's wound was caused by a dirty object, like a nail, the client is an increased risk of developing tetanus infection. Tetanus bacteria can grow in the dirt and be transferred to the client from the object. Therefore, the nurse should determine the client's vaccination status to determine if they need a booster. Let's review the steps to irrigate the wound. Start with hand hygiene and examine the wound. It's important to assess the wound for any drainage. Next, assess the client for any pain, since wound irrigation can be very painful. It's recommended to provide pain medication at least 30 minutes before wound irrigation. This can allow plenty of time for the medication to work before cleaning out the wound. Ensure that a towel or an absorbent pad is placed under the client to minimize the mess from the water. If the client has an old dressing, ensure to remove and discard the dressing. As presented in the illustration, position the client in a comfortable position that can also assist with the flow of irrigation. The flow of irrigation should work with gravity from the upper end to the lower end. This can assist with cleaning out the wound, but also limiting any contamination. Now we can apply any personal protective equipment, open your sterile supplies, and apply the gloves. It's important to mention that the supplies should be sterile since the wound is considered a break in the skin's integrity. A 35 millimeter sterile syringe with a large catheter like an 18 gauge or a 19 gauge should be filled up with the irrigation solution. This specific catheter size is ideal to provide the perfect pressure to clean the wound while limiting any tissue injury. Now we can begin to irrigate the wound by holding the syringe 1 inch or 2.5 centimeters above the wound. This action helps prevent the syringe from contaminating one area of the wound to another. Use a low continuous pressure to flush the wound, because this can help loosen up any particles on the wound surface. As mentioned before, it's important to irrigate downward to help minimize any contamination. Continue to flush the wound until the drainage from the wound is clear. Now, using a sterile gauze, you can dry the surrounding skin of the wound. Lastly, you can apply your dressing. And don't forget, always label your dressing with time, date, and your initials.